Welcome to the Torrance Memorial Pre-Operative Spine Surgery class. Thank you for taking the time to view this educational presentation. We encourage you and your family or caregiver to take an active role in your care and learn all that you can about your surgery and recovery. Class objectives. There are three main objectives for this class. 1. Identify your needs prior to and after surgery. 2. Review the clinical pathway. And 3. Review the role of the patient and family and multidisciplinary team along the continuum of care. There are 4 phases of care. The first phase is a preoperative phase. The second is your day of surgery. The third is the hospitalization phase. And last is your home and recovery phase. Pre-operative phase. Once your surgery date is determined, your surgeon will request certain tests and medical clearance from your primary care physician and/or specialist. This should happen weeks or months before your surgery. This includes a complete history and physical examination with your primary care physician or other healthcare provider. It is important to evaluate your overall health, medications you take, and any pre-existing conditions. In addition, you may need cardiology clearance, a pulmonary clearance, or endocrinology clearance, and you also have lab works or blood tests, an EKG, and a chest x-ray. Pre-registration and pre-testing. The next step is to register for your upcoming surgery at the hospital and make an appointment with a pre-testing nurse. This should happen at least 1 to 2 weeks before your surgery. During your appointment, a registered nurse will check your name, your date of birth, your admission status, your medical history, family history, and home medications. You will also be asked to confirm this information on the morning of your surgery and on the unit. Pre-registration and pre-testing is located in the Lundquist Tower on the first floor, and their hours are from 8 a.m. to 5 p.m. Their telephone number is area code 310-517-4754. Preparing for your surgery. When planning for your upcoming surgery, these are the things that you can do in the days or weeks prior to your surgery to not only ease your stress and worry, but also increase your chances of a successful outcome and recovery. 1. Find someone to drive you to and from the hospital. You will need your doctor's permission before you start driving again. Ask someone to stay with you for at least 24 to 48 hours after your surgery. Have a family member or caregiver stay with you to help with bathing, meals, and taking medications. Provide us with a list of emergency contacts. Eat a healthy, balanced diet. Focus on foods that are low in salt, saturated fats, and sugar. Increase your fiber. Eat foods high in fiber to help with constipation. Avoid alcohol. Consuming alcohol before your surgery could lead to complications during and after surgery. Quit smoking. Not only will you be healthier in the long run, but your post-operative outcomes may also be significantly improved. If you are sick at any time within the 10 days leading up to your surgery, report any of the following symptoms to your surgeon: cold, flu, fever or temperature above 101 degrees Fahrenheit, or chills, any type of infection, even a tooth abscess, any non-healing ulcers or skin wounds, any herpes outbreak, any skin rash, or any kind of flare-up. What to bring? These are the items that you should bring with you to the hospital. Bring a valid photo ID or driver's license, your health insurance plan card, a prescription insurance plan card with pharmacy bin plan number, a complete list of your current medications, including doses, supplements, and over-the-counter medications. Bring your eyeglasses with your eyeglasses case. No contact lenses. Bring your hearing aid. Bring your dentures with a case, your AICD or pacemaker card, a CPAP machine for patients with sleep apnea. Bring clothing and footwear. Bring loose, comfortable fitting clothing that could be easily removed, such as sweatpants or gym shorts. Bring slip-resistant rubber-soled shoes with backs. No open back shoes, flip-flops, or slippers. Bring a copy of your advance directive or living will. A brace or corset if instructed to bring it by your surgeon. And bring a form of payment for any copays or to fill discharge prescriptions at our outpatient pharmacy. What not to bring? Do not bring any valuables such as expensive jewelry, watches, large amounts of cash, or credit cards. Do not bring in any medications from home. Do not bring any home equipment. Do not bring any canes or a walker to the hospital unless you currently require them to walk into the hospital. You may leave your cane or walker with your family member or caregiver. The night before your surgery, do not eat anything after midnight or 8 hours prior to your surgery. You can drink up to 8 ounces of water only, finishing 2 hours before you arrive to surgery. If you need to take medications at home on the morning of surgery, do not exceed 8 ounces of water. And lastly, get a good night's sleep. The morning of your surgery. Plan to arrive 2 to 3 hours before your surgery. Do not drink any liquids or eat any food, including gum, mints, or candy. Your surgeon or the pre-testing staff will confirm which medications you should take the day of surgery. If you must take medications, swallow it with only a small sip of water. You can brush your teeth. Wear comfortable clothing that is easily removed. Wear comfortable non-skid rubber-soled shoes. Do not wear jewelry on the day of your surgery. This includes your wedding band. Do not use perfume, deodorants, powders, creams, makeup, or nail polish. We want you natural for your surgery. When you arrive to the hospital, park in the main parking structure. You will enter at the main entrance and check in at the admitting desk located in the Lundquist Tower Grand Lobby. It's across from the gift shop. Please check with the hospital or TMMC website regarding our current visitor policy. Checking in for your surgery. After checking in, you will remain in the waiting area until we take you to the pre-operative area. The anesthesia team will meet with you and your IV will be started before you go into surgery. A pre-operative nurse will confirm your identity, medical history, and planned procedure. You may be asked the same question several times by different healthcare providers. This is to ensure your safety and to ensure the procedure performed is what is planned for you. Your surgeon will see you prior to going into the operating room. They'll confirm your consent and mark the surgical site if needed. You will sign your consent after speaking to the surgeon. Your anesthesiologist will see you prior to going into the operating room to discuss the type of anesthesia planned and will inform you of all alternatives. You will be asked to sign your anesthesia consent after you speak with your anesthesiologist. We will do our best to be on time and will keep you informed if your surgery will be delayed because of emergency or if your doctor is running behind. After your surgery, you will be in the recovery room in post-anesthesia care unit until you are stable. You'll be connected to certain medical devices such as oxygen, a sequential compression device or SCD, foot pumps, IV fluids, drains, and a Foley catheter. We will monitor your vital signs and do neurological checks until you are stable. After your surgery, if you are alert, awake, and your vital signs are stable, you may go home for any outpatient procedures. You will be either transferred from recovery to an outpatient area to recover a little longer, or you will be discharged home. A nurse will go over all the instructions and the information you need to know regarding post-operative care. You will be taken by wheelchair to meet your ride home. Be sure it's a family member or friend. You cannot use a taxi or rideshare service. It is important to take your pain medication as prescribed to control your pain and keep you comfortable. Hospitalization phase. If you're going to be staying with us in the hospital, if you need to spend a night or even a few days in the hospital, you will be moved from the recovery room to a private or semi-private room based on the availability and level of care required. You may be able to have visitors there. Nurses will check on you periodically to take your vital signs and help manage your pain. Your surgeon will let you know your expected discharge date. Patient rooms. All patient rooms have a bathroom and shower, cable TV and pre-Wi-Fi, and a bedside telephone. Orthopedic staff. These are the members of your care team. Lead registered nurse. The lead registered nurse collaborates and oversees all unit staff and patient care team members to ensure safe patient care. Staff registered nurse. The staff registered nurse delivers daily patient care in collaboration with all healthcare team members. Certified nursing assistant. The certified nursing assistant assists nurses with plan of care and activities of daily living, such as bathing, toileting, and walking. Orthotech. The orthotech assists with the placement of orthopedic equipment for patients and assists patients with activities of daily living, such as exercises, walking, and toileting. The occupational therapist. The occupational therapist evaluates and develops a plan for a patient to complete activities of daily living. Occupational therapists will work on hygiene, grooming, dressing, and toileting. The physical therapist. The physical therapist examines and develops a plan to promote safe mobility. The physical therapist will work on getting you out of bed, walking, going up and down stairs, and getting you in and out of a car. Case manager nurse. The case manager nurse supports the physician and healthcare team members in the delivery of care and transition out of the hospital. They also help in managing the cost of care safely while enhancing the patient experience. The nurse practitioner. The nurse practitioner will see you throughout your hospital stay and work in collaboration with your surgeon and interdisciplinary team to ensure a smooth recovery and discharge home. Hospital room admission. After your surgery, you'll arrive to your hospital room. The nurse will check your vital signs and neurological checks. We'll check your blood pressure, your temperature, your heart rate, and your breathing. We'll do a dressing check to check your incision. We'll also do a skin check to check your skin for any pressure sores or wounds. We'll check your medical equipment such as your IV, the foot pumps, drains, Foley catheter to make sure they're working properly. We'll also do a nursing assessment from head to toe. We'll review your history and physical and any medications that you're taking. We'll also do a room orientation to show you how to use the call light, call button, how to operate the TV, how to operate your bed, and your telephone. And we'll go over your plan of care for that day. Patient room whiteboard. In every room, there's a whiteboard with information. This includes the hospital telephone number, your room number, today's date, the name of your nurse and their extension, your nursing assistant and their extension, the lead nurse and their extension, the name of your doctor, the nurse manager extension, food services, housekeeping, the plan of care, your pain treatment plan, when your next pain medication is due, your diet and activity, your planned discharge date, your discharge goals, and there's a place for you to write down any questions that you may have for your nurse. Patient safety. Call, don't fall. Please do not get out of bed on your own, even if it is to use the bathroom or get up from the bed to the chair. Always ask for assistance from a staff member. Call, don't fall. Medical devices. These are some of the devices you may have after surgery. A soft collar, a hard collar, a lumbar brace, incentive spirometer to help you with your breathing exercises, a sequential compression device or foot pumps to promote circulation and prevent blood clots, a Foley catheter to monitor your urine output, drains from your incision to help promote healing. Medications in the hospital. During your hospital stay, you will be on pain medications, antibiotics, medications to prevent blood clots, medications for nausea or vomiting, laxatives, and stool softeners. Pain control and pain safety. After your surgery, we will monitor your pain level to keep you as comfortable as possible. We follow a pain scale here at the hospital, and we use a scale from 0 to 10 to assess your pain level. You will be also monitored closely if you are receiving any opioids or narcotics, pain medications. Our goal is to transition you from IV to oral medications as soon as possible to use the least amount of opioids as possible. Please do not wait until your pain is severe. Notify your nurse when you are experiencing moderate pain. Pain medications will be given as ordered by a physician in 2 different ways. 1. Regularly scheduled intervals, which will be your overall pain control management. We will be giving you medications as scheduled to help control your pain. 2. As needed, when regularly scheduled medications are not maintaining effective pain control. We also follow a multimodal pain management, which is different types of treatment to manage your pain. This includes medications such as Tylenol or muscle relaxers, ice therapy, repositioning, sitting, walking, stretching, distraction such as listening to music, watching TV, or reading books. Stool softeners. Whenever you receive narcotics or anesthesia, they can cause constipation. Prior to your surgery, we advise you to start taking any stool softeners as needed 2 to 3 days before surgery to help reduce the risk of constipation. Drink plenty of fluids, keep active, and eat healthy meals that are high in fiber. After surgery diet. Most patients will return to a normal diet after surgery. We'll usually start you off on clear liquids such as ice chips, water, and then we'll slowly advance you to regular food as you tolerate intake. If you are having any nausea or vomiting, please inform your nurse right away to help control it. After surgery diet for patients that had an anterior cervical fusion. Patients should eat a soft diet for up to a week and may need to crush pills during the recovery period when swallowing is still difficult. Some examples of soft foods are yogurt, applesauce, mashed potatoes, pudding, creamy soups with no chunks. 3 things to do every hour while awake. Ankle pumps. Do 10 to 15 ankle pumps every 2 hours while awake to prevent blood clots. Deep breathing and incentive spirometry. Do some deep breathing exercises and use the incentive spirometer every 2 hours while awake to help decrease pneumonia and any breathing problems after surgery. Cough every 2 hours to clear your throat and to prevent pneumonia or any breathing problems after surgery. Patient goals for post-op day 0, day of surgery. So the goals for that day are to have your vital signs stable, adequate urine output, adequate pain control, tolerating your diet, and understanding the function of the equipment that you're going to be using after surgery, and the nursing and rehab team will work with you. All things will happen on post-op day 0. Resuming activities after surgery. After surgery, it is important to be active as soon as possible, such as getting up and sitting in a chair for your meals. This helps prevent blood complications such as blood clots, pneumonia, pressure sores, bladder infections. We want you to use your neck brace, back brace, abdominal binder. Do your physical therapy exercises. Log roll when getting out of bed. No BLT, which stands for no bending, no lifting more than 10 pounds, and no twisting. Post-op day 1, your first day after surgery. This is your care plan and goals for your first day after surgery. You will have lab work as ordered by your physician to monitor your lab results. You will work with physical therapy, occupational therapy. You will have an evaluation by a hospitalist or nurse practitioner. We will monitor your vital signs every shift and as needed. We want to make sure you're tolerating your activities and meals and that you have adequate pain control. If you're getting ready to be discharged, we'll start doing a patient post-op education. And if you are stable and cleared, you will be able to go home. Post-op day 2, your second day after surgery. You will have lab work as ordered by your physician. The physical therapy or occupational therapy will continue to work with you. You will have an evaluation by a hospitalist or nurse practitioner. We will monitor your vital signs every shift and as needed. We want to make sure you're tolerating your activities and meals. We also want to make sure you have adequate pain control. If you are ready to go home and if you are stable and cleared, we'll plan on doing discharge education with you. Or if you need a little time or extra rehab, we may need to send you to a rehab facility. Please keep in mind insurance coverage may limit your options on where you can go after your surgery. Discharge goals. To go home, you must be safe to go home. Activity goals must be met. Your pain must be controlled. And you have to be cleared by a surgeon and hospitalist. Most patients go home on post-operative day 1 or day 2. Going home checklist. These are the items that must be completed before we can let you go home. Discharge instructions and education. Your nurse will go over your post-op instructions such as pain control, medications, incision care, and follow-up. Equipment ordered if needed. We want to make sure you have a walker or a cane or certain medical equipment before we can let you go home. Home health therapy if ordered by your surgeon. Home health therapy will call you within 72 hours to set up an appointment. In the meantime, continue doing exercises as instructed by your physical therapist at the hospital. Prescriptions for medication. Make sure your prescriptions are ready and available to you before you go home. You may need to pick them up at your pharmacy or outpatient pharmacy. Transportation arrangements. Make sure you have someone to take you home after your surgery. Follow-up visit with your surgeon. Make sure you have an appointment to see your surgeon at least 2 weeks after your surgery. If all these items are complete, congratulations. You can go home and recover. Signs and symptoms to monitor at home. Call your surgeon if you experience any new changes in sensation or weakness, any signs of infection, such as chills, temperature greater than 101 degrees, any redness, swelling, or warmth around the incision, any increased yellow or cloudy or foul-smelling drainage from your incision. If your incision site separates, any signs of a blood clot, such as increased pain, swelling, redness, or warmth in your calves, increase in pain, vomiting, any bowel or bladder changes. Call 911 immediately if you experience any difficulty in breathing or shortness of breath, any chest pain not relieved by rest or medication, any fainting, any dizziness or disorientation. Frequently asked questions. When can I drive? Your surgeon will let you know when it's safe to drive again. Remember, you cannot drive while taking narcotic pain medications. When can I shower? It depends on your surgeon, but most patients can shower at home after 3 days. A waterproof dressing most likely will be applied and provided before discharge. When will I be fully recovered? The recovery is different for each individual, but most patients recover at an average of 3 to 6 months. The next part is important information from the rehabilitation team. Please remember that rehab will be tailored to each patient's sessions will vary. The rehabilitation team. The rehabilitation team consists of physical therapy and occupational therapy. Physical therapy. So physical therapy begins on the day of surgery within 3 to 5 hours after your surgery. The physical therapist will work with you on getting out of bed, getting up and walking, doing exercises, going up and down stairs, and evaluate you for any medical equipment recommendations. Occupational therapy. Occupational therapy usually begins on the day after your surgery. Occupational therapists will work with you on functional mobility, home safety, and activities of daily living such as hygiene, grooming, dressing, and toileting after your surgery. Activity goals for the day of surgery. Day 0. Getting out of bed. We want you to get out of bed on the same side as you do at home. You want you to make sure you stand with a walker, doing weight shifting and marching in place. And next, we want you walking with a front wheel walker in the hallway. We want you to normalize your walking pattern, posture, equal stride length, cadence, and weight shifting. And then sitting in a bedside chair for at least 30 minutes. And the rehab team will review of your exercise program with you. Activity goals for the day after surgery. or day 1. Stair training. Physical therapists will work with you on getting up, going down, up and down stairs. You'll also be doing some advanced exercises, discussing car transfers like getting in and out of a car. And occupational therapy will address safety and activities of daily living, such as hygiene and grooming, lower body dressing, toileting, and home safety education. These are possible symptoms you may experience after surgery. You may experience dizziness or lightheadedness. Your therapist will monitor your blood pressures throughout the session. You may experience nausea or vomiting. If this happens, the therapist will notify your nurse to administer some anti-nausea medication so you can still participate in your therapy session. Pain is an expected part of the rehab process. We will ask you to rate your pain on a scale of 0 to 10. We will control your pain using pain medication. You may also need cold therapy and range of motion exercises to help control the pain. Post-operative neck precautions. These are the precautions to keep you safe after your surgery. No bending, no stooping, and no reaching forward to touch your toes. Bend your knees and keep your back in a neutral position while at the sink. Use a long-handled reacher to grab things from the floor if you live alone. No lifting, no pushing and pulling. Remove any throw rugs at your home. Be careful of small objects and pets. Avoid turning your head from side to side, forward and back. Always log roll in and out of bed. You may be more comfortable with your head of the bed up to 15 degrees. Please confirm with your surgeon regarding the precautions that pertain to your situation. Post-operative back precautions. No sitting for greater than 15 to 30 minutes. No bending, no stooping, and no reaching forward to touch your toes. Bend your knees and keep your back in a neutral position while at the sink. Use a long-handled reacher if you are alone. No lifting, no pushing, and no pulling. No repetitive stair climbing. Remove your throw rugs at home. Be careful of small objects and pets. Do not twist your back. Always log roll in and out of bed. Please confirm with your surgeon regarding the precautions that pertain to your situation. Preparing your home environment. Remove throw rugs or have non-skid rugs. Make sure cords, obstacles, and pets are out of the way. Make sure your interior is well lit. Make sure walking spaces can accommodate your walker. If spaces are too narrow, use a sidestepping technique. Make sure frequently used items are at waist height, such as items in your bathroom, kitchen, and bedroom. Consider having grab bars installed in your bathroom and having a shower chair or tub bench. Try to have your meals prepped in advance. Possible home equipment. You may need a front wheel walker, which is the first phase of rehab, a single point cane, which is the second phase of rehab, a bedside commode, or elevated toilet seat. Therapy options after leaving the hospital. Sometimes you can go home with outpatient physical therapy, which is most common. Other times you may go home with home physical therapy, then transition to outpatient physical therapy in 1 or 2 weeks. Or sometimes you may need to be transferred to a skilled nursing facility for rehab, followed by home physical therapy, then transition to outpatient physical therapy. And finally, the last slide. Thank you. On behalf of the Torrance Memorial Lundquist Orthopedic and Spine Institute, we would like to extend our gratitude to you for trusting us with your care. Our goal at Torrance Memorial is to provide you with the information and guidance to make this a positive experience. We hope that this information provided in this presentation has helped you. If you have any questions or any concerns before or after your surgery, please do not hesitate to contact us or your surgeon's office. Again, thank you, and we look forward to taking care of you. Have a good day.